guys, welcome back to our channel, and today we're joined again by my lovely friend Megan.
Hello.
And we previously did a video talking about her depression. Now we thought we'd do a video about the medication she's on and also the medication she's tried. So what medication have you been on that has been for your depression?
So I'm currently on Venlafaxine. I was on a very high dose, but I'm on a mid dose now. I'm trying to sort of slowly lower the dose. I've also been on citalopram, fluoxetine, mirtazapine, sertraline, propranolol. Yeah, I'm not sure what else, but literally every single one I've tried does not help me whatsoever. I mean, I can say then they don't help me, but they might.
That's the thing.
I don't know, because I haven't been off them for nearly probably 8 years now.
Yeah.
And I really don't know what I'm like not on them.
Yeah.
But they do make me feel like a zombie. They just they're not the best thing to be on, and they don't cure your depression.
Yeah.
They don't cure your anxiety. I feel like they just cover up.
A bit like when you have a plaster, you cover up a wound.
Yeah, exactly. It just covers up the problem. It doesn't get to the root and sort that problem out, which is annoying, because a lot of GPs, they do just dish out medications here, there and everywhere, hence why I've been on 6 or 7 different medications. It's a joke. I shouldn't be on that. I shouldn't have been on that many medications. I'm not that old. I'm 24, I
was going to say, with the Sertraline, I also found that, because Mum was like, do you think the Sertraline helped? And I'm like, I don't know. Like, because I feel better than I was, but did I do that? Or did the Sertraline do that? I don't know, but how did you find the Sertraline? We found it the same, I think, because we spoke about it previously, didn't we?
Not great. I mean, sleeping is a problem. Insomnia, very bad. And I found that with a lot of them.
Yeah. What one do you think was the best one?
I couldn't tell you.
That's so weird.
I really couldn't tell you, because I haven't had great experiences with any of them. I get so many side effects from them as well.
What kind of side effects?
So I get sweating.
What's that from? All of them?
Every single one I've been on.
Oh my God.
Yawning. Can't stop yawning for some reason. It'd be like either increased appetite or decreased. It fluctuates. And then it would be things like trouble sleeping, fatigue, dry mouth. I get that a lot. I always have to have a drink on me because I get a dry mouth. Just lots and lots. And it's not nice.
Yeah.
And they say like there's nausea with it, but the anxiety makes me feel nauseous.
Yeah, so it's just like a big
lose-lose situation.
Yeah. What do you think the pros and cons are for the medication you've been on? So would you rather be on it than rather not, or is it kind of your just only last resort that you're hoping will work?
I'd rather not be on it.
Yeah.
Just because I don't think it's good to pump your body full of drugs that maybe you don't necessarily need. However, I can't say whether
they're helping. Same here.
It's a predicament because I don't know. But I take them because I'm told they're going to help me.
Yeah.
The doctor says, take these, it'll make you feel better.
Yeah.
But honestly, no, I don't know. And I'm going to wean myself. I'm going to go to the doctor and ask him about weaning myself off of the Venlafaxine and seeing how I get on in the next few months on lower dose, and maybe hopefully stopping altogether. And then I'd like to compare and see how I feel. And if I don't feel great, then I will go back on them, because I will know that they are helping.
Yeah. It's that coming off period as well, because you need to adjust to it, don't you? When I tried to come off Sertraline, I found it, I was on 100 and then went down to 50, and I was like all over the place. So I went back on them. So it's kind of that coming, kind of like drugs anyway, coming off them and kind of being a bit like, and then stabling out
cold
after.
turkey.
Yeah. and then but yeah, maybe coming off them a bit by bit. I cut it 50-50.
Yeah, don't.
Yeah.
It's really bad.
Yeah.
Silly
Silly
sound.
Yeah. Silly sound. Oh my god. How do you think depression could be helped in a long-term way without medication and whatnot?
I think it all comes down to having the best counsellor or therapist that can give you the time, that you're not allotted 12 slots, you know, that can give you the time for your recovery, even if it takes 6 months, a year. They are there for you. You know, you go once a week and learn strategies to help you and to check in with them and to make sure that, you know, you are focusing on the problem and you're getting to the root of it and you're sorting that out with your therapist who can teach you ways of dealing with that instead of just masking it with a tablet, you know, because at the end of the day, unless you talk about it and understand, you're never going to get better, I don't think. You know, you need to be able to deconstruct your life and see where the root's coming from.
Yeah, more time, more understanding, more compassion.
But obviously it all comes down to money again. So unfortunately we can't have more than 12 slots, but
maybe one day.
Yeah.
So that's it today, guys. We hope you found that interesting. Let us know if you have any views or questions or anything like that. We'd love to hear from you. So yeah, hope you enjoyed. Thank you.
Thank you.